Conditions that once took years. Women's healthcare is changing fast. Conditions that once took years to diagnose are now being identified in months. Women are walking into doctor's appointments better informed and seeing real changes in their health. Digital tools are making care more personal and more accessible, and it's only getting started. But Africa's voice in this global conversation is still too quiet. That is about to change. On March 11, 2026, the first ever Better Woman Health Conference is bringing together the women driving this shift and the builders, founders, and operators shaping what comes next. The theme is Breaking Barriers, Women, Health, Africa. So whether you are a woman who wants to understand what's being built for your body and your health, or you are in the room building it, this is your event. It's a 90-minute virtual conversation where you'll hear directly from clinicians, founders, and innovators building the future of women's health across Africa. And you get to understand what it means for you personally. So register and be a part of this event. You don't just want to build tools for your health. You also want to make sure you are connected to the conversations shaping it. See you there. Women's healthcare is changing fast. Conditions that once took years to diagnose are now being identified in months. Women are walking into doctor's appointments better informed and seeing real changes in their health. Digital tools are making care more personal and more accessible, and it's only getting started. But Africa's voice in this global conversation is too quiet. That is about to change. On March 11, 2026, the first ever Better Woman Health Conference is bringing together the women driving this shift and the builders, founders, and operators shaping what comes next. The theme is Breaking Barriers, Women, Health, Africa. So whether you are a woman who wants to understand what's being built for your body and your health, or you are in the room building it, this is your event. It's a 90-minute virtual conversation where you'll hear directly from clinicians, founders, and innovators building the future of women's health across Africa. And you get to understand what it means for you personally. So register and be a part of this event. You don't just want to build tools for your health. You also want to make sure you are connected to the conversations shaping it. See you there.
Okay. Welcome everyone. Good day, welcome. So we are streaming this event live across our social media platforms, Facebook, Instagram, LinkedIn, and YouTube. So wherever you are joining us from, welcome. Welcome to Breaking Barriers, Women, Health, Africa. I'm so glad that you are here, and I'll be your the host and anchor for this event. I'm Dr. Ayomide Owoduni. This month is International Women's Month, and we just celebrated International Women's Day 3 days ago. And rather than simply celebrate, we choose to convene, we choose to have real, honest conversations about what is actually happening in African women's health. We know that women's health is growing globally. There has been so many conversations about what is happening, what is changing, what needs to change about women's health. But Africa is still underrepresented in these conversations. And despite the fact that tools are being built, the capital is being deployed to a certain extent, we still are not having the conversations that we should be having. And we are about to change that today, at least in this room. We are going to talk about what femtech really is beyond the hype, what is actually being built on the continent right now, what is working and what is not, what must change for women's health innovation, and what we need to genuinely scale femtech in Africa. So, a bit about Better Woman Health, the platform through which we are hosting this event. Better Woman Health is an initiative that is dedicated to advancing women's health through credible information, thoughtful conversations, and ecosystem building. Our work focuses on advancing women's health knowledge, supporting credible innovation in femtech, building clinical insights with health technology, and building conversations that move women's health forward. And we have amazing women and men in this room today. So this event is bringing together a diverse community across the women's health ecosystem. We have clinicians, we have femtech founders and builders, we have investors and funders, students and early career professionals, advocates and policy makers, and also health conscious women. It seems like a lot of people in one room, but that is actually intentional. We need all of these people to contribute their voices to scale women's health in Africa, and every single person's voice matters. So if you are in the if you are a part of the audience, you can still contribute to this conversation. Please, you can share your questions, your contribution in the live chat, and it will be read out at the end of the panel session, and hopefully your questions will be answered. So for the next 90 minutes, we'll open with a global perspective on femtech, what is happening on the global scale, and that will be handled by our global speaker, Anna Sein. And then we'll have a brief brand spotlight, because we have African women's health brands here in the room, and they'll tell us what they are doing for women. And then we'll move into the African perspective panel, where we have three voices representing the African perspective. We have an investor, a clinician, and someone who is building for Africa. And then we'll have the audience question and answer session. So a brief word about myself. I'm Dr. Ayomide Owoduni. Like I said earlier, I'm a medical doctor and a femtech credibility advisor, and I help femtech brands and founders globally build products that are clinically credible and can withstand regulatory scrutiny. We'll move into the global lens now. We have Anna Sein, who is going to take us on that conversation. Anna Sein is an ex-Femtech founder and the founder of NORA Initiative. She's the founder of the women's health platform Tilly, which was acquired by RARE in 2025. Her entrepreneurial journey, along with her work investing in women's health and working with the Swedish healthcare system, has given her a deep understanding of the structural and systemic gaps holding women's health back. As a result, she founded NORA Initiative, which is a non-profit organization mobilizing cross-sector collaboration and catalytic capital to drive structural change. She has spoken at the Nordic Council of Ministers on the Nordic Charter for Women's Health 2040, and she's definitely one of the most grounded and honest voices we can have in this space today. I happened to meet Anna through her co-founder, Jeanette, and we had a very interesting conversation on the Nordic Charter for Women's Health. And I'm so glad that she's part of this conversation today, and she will be giving us the global perspective. So Anna, the floor is yours.
Thank you so much. Can you hear and see me? Yeah, perfect.
Yes, we can.
Great. Am I also getting some help to just get the slides up? Some technical stuff first here, but just so you can see them. You know, can you see my slides now? No, I can't see you. So I'm just gonna start talking then. Thank you so much for having me. There we go. Perfect. Thank you so much for having me. This is a very interesting conversation, and thank you so much for the introduction as well. And I think sort of my personal journey in women's health is very sort of representative also for the narrative here today that sort of starts off in what is femtech. Because today it's hard to imagine that before 2016 we didn't even have the term femtech, which was then sort of invented by Ida Tin, who was the founder of Clue, a cycle tracking app. And I founded Tilly, which was very much part of this first wave of femtech companies, as I call them, that were consumer tools and to very, very large extent apps that would help with self-monitoring and tracking and so on. Very often menstrual health, fertility, like Tilly, or postpartum, like tied to maternal health. And of course, this happened because there was such a gap in the market. A lot of women were looking for support and information and weren't getting it from the healthcare system. And so these tools sort of came in and filled that gap. But it's also, if you sort of scratch under the surface, important to remember that since women's health has been so under-researched, there was a huge data gap. And so in many ways, these platforms were also data platforms that started to gather data. And over time, these data sets have enabled more clinical research and more regulated products, which, if you change the slide, thank you, sort of takes us to the second wave and the change that we see now, where much more femtech companies are entering the clinical agenda, becoming medical devices, and instead of sort of creating parallel pathways, actually redesigning the existing care pathways, supporting diagnosis or clinical decision making and so on. And this is a great change that is, of course, needed because it's, in many ways, how we create actual impact for women. And so with this change, if we change the slide, it is sort of important then perhaps to remind ourselves sometimes what is femtech, because I think many people that are not in the sector, they tend to get stuck in this period tracking perspective, while really femtech is not about a specific product category. It is a structural correction in healthcare design, where we start designing healthcare around the biological and the social and the economic realities that have historically been ignored. And of course, with this change, we not only see more solutions sort of entering the clinical agenda, as I already mentioned, but also widening of the perspective on the disease burden, because women's health or femtech is not only about the female-specific conditions, but we also have cardiovascular disease and Alzheimer's, and of course menopause and the life cycle perspective, and the ties then to osteoporosis and so on. And so we widen that perspective as well, which is great, of course. If we move on to the next slide, I'm going to touch a little bit. Considering then that this femtech definition has been around, in Europe, where I am based, for a little more than 10 years now. There are, of course, some learnings to be made from what worked and what didn't. And it's going to be interesting to hear the conversation later on today, again, how that can be sort of transferable to your markets. As I already said, I think one success factor was, of course, thank you, sort of the unlocking of data in new insights in an under-researched areas. like these platforms really unlock data, and the most successful cases have been the platforms that did, with help from this data, start to deliver more than wellness, basically clinical evidence and regulatory legitimacy, um, but also more hybrid models, basically combining digital touch points, but also with physical care. Because, of course, putting women more in control and giving them more information has a great value. But to create real impact, we also need to provide care, and some care provide, like, there is a necessity for physical touch points. So where the companies that have been able to combine these two in a good way have been the most successful. And also, of course, I mean, with more clinical evidence and more regulatory legitimacy, we can also see more capital go into the sector, because these things create competitive advantages and more sturdy companies that create real impact. Having said that, if we look at the point number one here, should not underestimate sort of the trust that building for these real pain points created, because this is how these platforms were able to gather this data and move into more clinical products. So like the actual community-led growth has been very important, and there's learnings to be made there, even for the products that don't remain consumer products. And I think some of the very interesting development we see now is where these platforms that gather data and that have established trust and community-led growth can be combined and partner up sometimes with pharmaceutical companies, for example, to combine this like community and data with the muscles to drive regulatory legitimacy. So that's interesting. And we already moved on to the next slide, because, I mean, speaking of establishing clinical evidence, this is things that take time. And I think where we have seen femtech struggle is not so much in the innovation or the technology itself. It's been more perhaps the match between sort of the capital's expectations and the growth. And this is not unique for women's health or femtech. We see this in health tech or healthcare in general, that timelines are long. There are often structural barriers, like, for example, educating healthcare staff, or even health literacy and trust, and having people even understand that they should seek help, that stand in the way for just a super quick adoption. So I think what we have seen is that, yes, I mean, there was this idea that there is 51% of the population and there's such a untapped demand. We haven't built for this part of the population. But building in healthcare takes time. We can't expect it to behave like fintech or social media. There might be need for other types of capital and to come in and be more patient and work with these structural barriers parallel to the innovation. So that is something that is has been an important learning, because if we jump to the next slide, I mean, yes, femtech has been around for 10 years, and still, I mean, and we've gotten so far in many ways. So much has happened, but I mean, we still have women spend 25% less time of their life in good health. We still have too little capital going to both fundamental research and innovation in women's health. So, and I think this is sort of important to, I mean, not to become not to lose hope, but to remind ourselves that there are still things to be done, and innovation in itself is not the only answer. We also have to build the infrastructure to get the innovation to the patients, basically. And so if we move to the next one, like just to summarize some of these learnings, yes, I mean, very fundamental, choose the right problem. Don't, I mean, yes, there are categories that trend, and you might hear from VCs or etc. that sort of take up on those. But I mean, what is going to create lasting change is when you start with the highest friction problem and also solve for outcomes that matter to systems. Look at sort of the impact of the problems that you are solving for societies, both in terms of wellness and in economical values. And of course, go beyond apps. We've been into that, into hybrid models or tools with clinical evidence and regulatory legitimacy. It's important to that is something that we've learned over the last 10 years, that this is important for long-term success. And I mean, speaking of building then the evidence base, there is, I mean, these collaborative efforts where we can have perhaps consumer platforms or community-led, community-closed platforms that help build trust, perhaps improve health literacy, actually reach out, but combine them with whether it's research centers or life science companies, where we can sort of have these collaborative efforts, and also make sure that we always measure outcomes and economic returns, because this is when we will have capital flow more freely to the sector. Thank you. And yeah, secure access pathways from day one. I think many of the first wave of femtech companies, yes, they definitely solved the problem, but they did not have a clear idea of how to actually reach women and to sort of integrate with the system and or the payers, because the payer is obviously different in different systems. But if there is no market and no way to for an access pathway, there's not a sustainable business or solution. And I mean, this can be through the healthcare system, but there's also community distribution models and informal to formal care bridging, speaking of breaking down systemic barriers, sorry. And then I spoke about collaborative efforts for gathering data. This is also true for investments. This is what Nora, that I work with now, work with to a large extent, because risk capital is alone is not going to sort of take us the whole way. We also need more blended finance to come in earlier to de-risk the investments for VC capital. And to do this, to get the public, private, and philanthropic sources in, we need to set up sort of investable projects and collaborative efforts. So these are sort of some things that I think are transferable, but it's going to be really interesting to listen into the panels here on how this can be transferred into where you are right now. So thank you so much for listening, and thank you for having me.
Thank you so much, Anna. Thank you very, very much. You have really just set the stage for us having the African part of this conversation, because you've mentioned a lot of things that are actually relatable and can be transferred to the African markets, to the African system. Because one thing you mentioned is that beyond the information, women actually need the physical touch. So we are moving beyond the era of just creating apps that we cannot really relate or women cannot relate to, but we are now moving to the hybrid method where we can interact with these women, we can offer services, and it's not just an app that they are interacting with. And also, you also mentioned solving a problem that is valuable, a problem that there's really affects women, not just from an idea. And that's also very important in Africa because there are certain people that I have interacted with, and there's a common misunderstanding that because I have a problem or because it happened to me, then I should start something to solve that problem. But it doesn't always work that way. There's so much to consider before looking into should I start a femtech brand or what can I do to solve that problem. So thank you very much, Anna, for setting the stage, and we'll hopefully pick it up from here looking at the African perspective. But before we go on to have our panel session, we have a brand who will be doing the brand spotlight. A representative from Viva Femini will, in a few minutes, tell us about what they are building, who they are building it for, and what they hope to achieve in building the brand Viva Femini. So over to you, Aisha.
Okay, hello, good evening, good day. So, my name is Aisha Mohammed Usman. I am the grant and partnership lead at Viva Femini. I briefly want to talk about Viva Femini. Next slide, please. Okay, so millions of women in Africa type their symptoms on Google because the alternate is visiting a clinic they can't afford. Some people can't reach it or can't risk the stigma they go through. 1 in 22 women, that's how many Nigerians die from pregnancy related causes, 5 times the global rate. Let that number sink in for a second. Now imagine being one of the 21 who survive but can't afford a doctor who listens or a space to ask the questions you are too ashamed to say out loud. I'm here to tell you there's a better way. Next slide, please. Okay, so okay, sorry, my screen was lagging a bit. So the problems: 63% of women in Nigeria rely on unverified online sources. We Google, all of us, most of us. We Google our symptoms, and sometimes they are over exaggerated results online. 1 in 22 Nigerian women die from pregnancy related causes, and over 200 million African women face stigma, privacy risk, and challenges accessing health. Next slide, please. Okay, this is where Viva Femini comes in, Africa's trusted clinically safe women's health ecosystem. So we have the Smart Cycle pregnancy and wellness tracker, the 24 hours telehealth consultations, safe spaces for paid subscribers, and AI-enabled experts vetted digital platform. So everything that goes onto Viva Femini has been clinically verified by experts in the field that have several years of experience, and they are the right people to talk to these people. So most of the times, even if you have the platform to check your problems or say your anonymous problems, you don't have people that respond to you. People talk on their experiences, which might not be different or might not be the same for your case. But then on these platforms, we have people that are clinically vetted, and they are the right people to listen to your problems. Next slide, please. So Viva Femini is in its final stage of beta testing. We have over 6,000 women on our wait list. 78% completed sign-up flow, indicated strong intent. We've partnered with 10 plus healthcare facilities pre-signed for telehealth plots, 5 pharmacies on discussions for distribution and wellness collaborations, 3 NGOs confirmed to partner, and we are still looking out for more partners. Anybody that wants to work with Viva Femini, if you are aligned on girls' reproductive system. Viva Femini covers from adolescence age of teenage girls to women that are going through fertility issues, the pregnant women, postpartum mothers, and menopause. So if we are willing to align with a cause, that Viva Femini is here. So our competitive advantage, there are other, in summary, there are other platforms, but how we stand out is it is the full Africa localization. We are implementing our local languages, our local delicacies. Sometimes these international apps, they tell you, for example, let's take the meal recommendation. They recommend meals that we don't even know what they are here. So Viva Femini is giving you the African context. It is optimized for low bandwidth, telehealth with vetted licensed clinicals, safe and moderate healthcare professionals. It is deeply embedded and it is very, very low and affordable. Next slide, please. So the impact at scale is saving lives, empowering women. It is aligned with the SDG goals, reduce mortality rates, empower millions of African women, build Africa's largest women health ecosystem. Next slide, please. So this is the MVP launch. So we are launching second week of April. We are currently doing our final tests of the beta testing. Next slide, please. So in conclusion, African women are the backbone of our economies, our families, our communities. So why is their health still an afterthought? Viva Femini means long live women, but we can't do that alone. So here's my ask. If you're a clinical, join our network. If you're an investor, let's talk. If you're a woman who simply believes they deserve better, find us at vivafemini.org. That's also where you can join our wait list. If you are also interested in the course and would like to be a part of our beta testing, Viva Femini is here and you can reach us. Next slide, please. So yes, you can reach us at partnerships at vivafemini.com. And lastly, yes, we're still open to partnerships. If any of what I've said resonates with you and you want to join this course, please reach out to us. Thank you.
Thank you very much, Aisha. Thank you. That's one of the amazing brands building in Africa. And we really appreciate your presentation, Aisha. So you can reach out to them, check them on social media platforms, and they'll drop the link to their platform so that we can check out what they are doing and see how much they benefit women. Now we'll be moving to our panel session. So we have three major voices speaking from three different perspectives on the panel today. And they are all speaking from African reality. So they are going to give us what is obtainable here in Africa. The first person is our investor. Evelyn Castle is a health executive and impact investor and the co-founder of EHA Impact Ventures. She co-founded eHealth Africa and EHA Clinics, leading efforts that raised over $250 million and supported landmark public health milestones, including polio eradication in Nigeria and Ebola containment in West Africa. In 2021, she co-founded EHA Impact Ventures, deploying catalytic capital and hands-on operational support to close the funding gap for African women entrepreneurs. Her portfolio includes investments in Ananya Health and EHA clinics. So I first got to meet Evelyn Castle through their investments in Moped Foods. It's one brand that I'm familiar with, although it's not a femtech brand. But looking more closely, I realized that they actually have affiliations with femtech and they are supporting women-led brands, startups in Africa. And that was something that I was excited about and decided she has to be a part of this conversation. Welcome, Evelyn. Our clinician voice, we have Dr. Wanjeri Millicent. She's a medical doctor and digital health strategist based in Kenya. She serves as the Africa Breast Cancer and Vision Digital and Data Lead at Roche, leading digital integration to strengthen breast and cervical cancer screening, diagnosis, and continuity of care. Through the Empower program, she has supported scale across 76 clinics, reaching over 235,000 women. She sits at the intersection of clinical practice and digital health every single day, and she will bring us the perspectives that too many technology conversations leave out. Uh, Dr. Wanjeri, I'm really glad you are here. It's not so often that we see clinicians who decided to step out of the four walls of the clinic. So she's a doctor who is not just defined to working as a clinician, but she has taken her knowledge out to help empower women. And 235,000 women is not something that happens by accident. So she has intentionally put in effort to ensure that she can reach women. And we are happy to have you on the panel today. Welcome, Dr. Wanjeri. For our builder's voice, we have Anne Uchendu Ogunyomi. She's a maternal health innovator and the founder of Lavender Care, a femtech platform connecting mothers with healthcare providers, structured care programs, and essential postpartum services through technology. She also leads the Postpartum Support Foundation, a global initiative advancing awareness and support for maternal mental health, and is building right now. She's navigating the real challenges of developing a femtech product for the African market. And the one reason I decided Anne should be a part of this panel session is like what Anna said when she was speaking. A lot of people already assume femtech is defined only by period tracking apps, but we do not see how much more femtech is beyond that. And so I decided Anne should be a part of this panel session so she can bring in her voice. She's building something that is not really talked about, and that's the postpartum period. Many women are sent home after delivery without proper follow-up and care. And Anne has built something to support these women. So we have an investor, a clinician, and a builder. And you can agree with me that we do not always have all these voices in the same room at the same time. But today we have them. So let's get right into it. We'll start with a reality check. Recently, for some years now, there's been a lot of excitement about femtech in Africa, and I do believe the excitement is warranted. There's been some enthusiasm. People are building. We are starting to see that there's so much more that can be done for the woman. We have refused to accept that women should not be part of clinical trials or that women should not have their health looked into more closely. So I'll start with Anne. You are in the middle of building, you are building a brand for African women. But what would you say surprised you most about building a femtech product for the African market? And what assumptions did you have to throw out during the process of building?
Okay, hi everyone. Please confirm that you can hear me. Okay, it's really great to be here today. So I won't say surprised. I would say something I got to experience firsthand, and that would be the absence of data that is relatable and data that is, that speaks really about the African and the Nigerian context. And that's something that we currently struggle with. And so I think that that's one thing that I knew that that gap was there, but then we're then faced with that reality, just trying to build here. Assumptions really. I don't think I would say that nothing really shocked me, for lack of a better word, when I decided to build in this space, I knew the shortfalls, I knew what the gaps were, so it was just currently we are navigating through the shortfalls, navigating through the gaps, right? So honestly, if I wouldn't say that I was surprised or there are any assumptions or anything. I knew what we were getting into, and we are literally just building and living through it.
Okay, thank you very much. And like you mentioned, there's actually a research gap when it comes to women's health, and
Yeah.
that's part of what Femtech is addressing, and I'm really happy about that. Or while building a postpartum care brand, it's like I said, I feel personally that it's one of the most neglected areas when it comes to women's health. But what made you decide that that's what you want to focus on and you want to tackle the issue of postpartum care?
Okay, so it was from my personal experience. I became a mom in 2017, and I had a really traumatic childbirth, and I even almost lost my life giving birth. Right, but what then happened afterwards was what prompted me to say I had to do something. And I didn't just jump right into building lavender care. So from 2018 I started postpartum support foundation, and the aim was simply to raise awareness about the postpartum period, about how to get support, and funny enough, because of when I started, the Nigerian audience that I was raising their awareness for didn't really they were my typical target audience, but then it wasn't something that we talked about. And again, this is where culture comes in. This is where the African setting comes in. So the audience that took on that message and rode with it was were people outside of Nigeria, outside of Africa. Currently, our top five countries are not Nigeria is not one of our top five countries. We have the US, UK, Canada, even Asia, some Asian countries as well. So it was my personal experience. It was the fact that there is this huge gap, not just in the care that the women get, but even in as simple things as education. What happens with you, so after birth, what happens to your mind? How do you navigate these things? How do you get help? Education was lacking. In my case, for instance, nobody told me. I had to Google. We've talked about Google here on this call. I had to Google my symptoms. So why am I feeling this way? Why am I not connecting with my child? And it was research that got me to say, oh, okay, really. So there's something called postpartum depression. There's something called anxiety. I started learning about these problems by just researching by myself, and I think that women and mothers deserve basic education regarding these things, and then we can now then talk about support. So I then started to build lavender care, following seeing that the gap still existed despite my advocacy, despite talking about it, despite the awareness. And so I'm like, okay, if we're going to do this, of course, I think Anna also mentioned how it's not about building apps. With lavender care is not a mobile app. We're building the digital infrastructure for postpartum care, right? So, so that was a personal experience that got me to say, you know what, we need to solve this problem. Obviously, we will not solve it for everybody, but if you can reach a good number of women, I mean, we already know that women are like the backbone of society, and so if we're able to solve this problem for some women, then we'll be doing society a great good.
Thank you very much. And thank you. You really touched some major points. Getting the women you are even trying to reach to understand what you are building for them and why they should be a part of it is can sometimes be tasking because these women
Yeah.
don't even know why they should be a part of what you are building, what they benefit from it, how they can participate. So a lot of times we have to start with educating the women on why this should even exist before letting them know, okay, this exists as well. So thank you very
Absolutely.
much for sharing that experience.
Thank
We'll
you.
move to Evelyn. So, Evelyn, you're actively investing in women's health. Currently, I know you are working with a brand, Anaya Health, which is a femtech brand. So when you look at femtech opportunities in Africa, what are those things that makes you excited when you see these opportunities? And on the other side, what makes you hesitate when it comes to investing and funding?
hmm yeah, so thanks so much again for having me. From my perspective around like what we look for, who we want to invest in, um, the kind of like interesting thing about femtech is that like women have been solving these problems, for like generations, right? We're always solving like these problems over and over again. And what has really changed in the last couple of decades is this encouragement of women to get into the business field, and to start businesses. So instead of multiple different women having to solve the same problem, we can have one woman who has solved the problem and then offer that resource to other women. And so for me, that's what I think is really exciting, is these solutions that have already been working, that women then say, hey, I want to make this available to other people. How can I turn this into a business? And it's not necessarily about the money. A lot of times it's about, this was really helpful for me. How can I help other women with this resource? So that is what is exciting to me, because it shows that it's effective. It shows that the solution is wanted. It shows that it's useful. And so to me, it's kind of like a no-brainer as to yeah, of course, this is going to be successful if it gets turned into a business as well. Some of the things that caused me a pause is one, if it's a only male founder, don't come talk to me. I think women need to be solving women's health problems. So for all of the men in the room, I love that you love women's health. That's amazing. But, really focusing on getting a great female co-founder who can give the female perspective, I think it is so important, because, of course we need male allies, but we also need women, making these decisions. The other thing that always gives me pause is when people are selling me on something and they're like, oh, it's the Uber for Africa, or it's the blah, blah, blah for Africa. That's not just, I don't know. It's not that exciting to me. And especially because we know that things can't just you can't just drop technology in Africa and say oh, it's, it works. You have to design things for the African context in order to make it more relevant. So those are two things that just kind of give me a little bit of pause when I talk to companies.
Thank you very much, Evelyn. Thank you. You've touched a really important point. You have to know the women that you want to build for before you can come for the investment. Thank you very much for mentioning that. We'll move over to Dr. Millicent. Like I said, she's a clinician, and we also need to understand how we can reach these women, because a lot of women actually trust clinicians. And if we are not able to connect what we are building to the healthcare system, then we are less likely to have women to accept it. So, Dr. Millicent, from the clinical side, when a new healthcare tech tool comes across your desk, what makes you trust it or not trust it?
Great. Thanks so much for that question. First, not to belabor the point, but to emphasize on what Evelyn has said. Women-led, women-owned solutions with African context that have an integration. And I think that's where the clinicians come in, that having a digital solution is one element, but an integrated approach to using that solution is another element. And what do I mean by that? That from clinical practice, the solution comes with different functionalities. But do those functionalities speak to me first as a clinician in terms of my daily processes, protocols, and guidelines? That we must understand that it's not enough to build a tech tool. It's about the science, it's about the technology, it's about the business of deploying that particular tool and the regulatory frameworks around it. I think the first speaker was very clear that now we are moving to shaping regulatory systems. So the trust element comes with a blend of those four things. That when I look at it, does it speak to all four parameters that are contributory to best care for our patients, if at all it's not the standard of care that's available, regardless of the particular disease? The second thing is the issue of data. Data governance is a very hot topic in the healthcare sector, because we know data can be misused if at all it's not governed properly. So who owns the data? Where is the patient data sitting? What are the governing laws for this data? GDPR being a key topic in our African setting. The third thing in terms of trust is just also the ease of use of the solution. I always say when it comes to healthcare workers in Africa, most of them are overworked, underpaid, emotionally drained, having to work in low resource settings, having to innovate on the feet with where we are lacking basic things like essential medicines. Coming to layer on technology sometimes can really be burdensome. So the question is, for me to use this tool, is it creating additional efficiencies in my day-to-day work, or is it a burden? So when we put those three things together, is the decision touch points of a healthcare worker are clear. But we are seeing the changing persona of the patients day by day. And now patients are coming in. I think we've had patients are now checking symptoms on Google. Patients are now checking symptoms on TikTok. Patients are seeing health information on Instagram. So as clinicians, you're also stuck at that point whereby you must also move with the wave, that not only do you adapt digital solutions for your day-to-day operational processes and clinical decision making, but you also adopt digital solutions based on what the signals the patients are telling you, the source of information, where are they also getting trust for the care of services, and also where are they asking the right questions. So back to you, Doc.
Thank you very much for highlighting those, Dr. Millicent. I can actually relate, and I do believe a lot of clinicians that are joining us today would relate to what it means to practice in an African setting. I like to say it's an extreme sport because you have to be innovative, you have to think outside the box every single time. And yes, we are doing it for women. And like you said, it's actually not rewarded as it should be. But that's why I'm happy that Femtech is bringing these tools to us so that together with the brands that are building these solutions, we can reach women better. Okay, so we'll be moving to our second theme, which take us deeper into this conversation, which is like the hard stuff. So one of the things this room deserves is actually a honest conversation on the real barriers that are faced while in building or funding or investing in femtech. So we'll go back to Anne. And what would you say is your biggest operational challenge right now while building Lavender Care? I think you can go on, please.
Okay. Again, please confirm that you can hear me. Okay, great.
Yes.
Okay, honestly, again, I think that largely one of the things that would I would consider a challenge is um, the need to. I mean, so in a typical Nigerian setting, or maybe globally, I don't know, but antenatal care is structured. For instance, you know that when you're pregnant, there are protocols that you follow. There are vaccines you have to take. There are tests you have to do. So there's structure around antenatal care, childbirth. You know, but when it comes to the period after the child is born, um, then there's no structure around that. So maybe one should leave the four walls of the hospital. That's for so I'll give myself as an example. I've had three children. I had all my babies here in Nigeria, right? And I had them at 2 years. They have like 2 year gaps in between. And the same process that I went through having my first child was the same process I went through having my last child. So basically, there was no improvement in care, right? So it wasn't like the care evolved or there were improvements over time, right? I've also, obviously, because of my work, interacted with mothers, even in 2026. And then once you leave the four walls of the hospital, that's it. There is no follow-up care. There is no follow-up support. Women struggle with breastfeeding. We encourage mothers to do 6 months exclusive breastfeeding, but women struggle to breastfeed, and there is no one supporting them to do this. You hear stories of women who probably had issues with if they had C-sections, they had issues with the sutures and all of that. So it's a lot of, and these are just you have pelvic floor issues, and then so first of all, the fact that there is no structure around postpartum care is a problem. So it means that we are speaking to not just the mothers now, we're speaking to hospital owners, we are speaking to clinicians, we are speaking to all these individual providers to say, you know what, we need to work together to sort of like make postpartum care coordinated. so that when a mother needs to get support after birth, she knows that she can get this kind of support from here, right? So she knows that if she, because you hear women say, "Oh, I felt alone. I didn't know who to speak to. I didn't know how to resolve it. I thought," and the African setting, we are typically strong women, right? And so people just assume that you'll figure it out by yourself, right? But when women know that they when they are going through these issues, there's actually somewhere that they can go to, or there is actually structured care or support that they can get to, help them recover fully, then it just makes it better. So I think one thing, the lack of structure in postpartum care. Secondly, it would be, again, I'll go back to data and the limitations when it comes to research and all of that is also one big problem. And I think so far, I think that's those are the main challenges we've faced so far, really.
Thank you very much for highlighting those. Is I'm actually quite sad that women have to go through the same thing again and again, and there's no change in their experience. And we are thankful you are building something to actually change that for women out there. But what would you want policymakers and investors to know about the maternal health gap in Africa? What would you like them to understand about that health gap? Because we've established that there's a maternal health gap in Africa and even
Yeah.
outside Africa. But what would you want policymakers and investors to know?
Okay, so 2 weeks ago, I was in a room with stakeholders in Lagos State, where we are trying to put together a care policy for Lagos State. And the care policy basically is to drive policies that support the care economy basically in Nigeria. But I mean, that's just one as on Lagos. Well, we are starting with Lagos, of course, but that's just one aspect. You have the care economy, and then you have the healthcare policies as well. So, firstly, even when we speak to hospitals, because we have like a healthcare management system where um, we are. What, again, I always say again that lavender care is not an app. So I'll give an example. Maternal mental health is not something that is put into maternal care. So you can have the physical care, you can have the all the other care, but maternal mental health is not part of your. For instance, you want to do antenatal care, it's not something that they do, right? But when we speak to hospitals, we say you need to incorporate mental health into the care that you provide to mothers. And so, for instance, a mother comes to register for antenatal care. She goes through a mental health screening. You can administer the screening maybe during the pregnancy and postpartum as well. So this helps us to know, okay, at what point did this mental health issue start? Was it during before the pregnancy? Was it while she was carrying the child? Was it postpartum? Is it because of lack of support? Is it these hormonal issues that we always talk about? So it helps us know what the problems are and basically how to support the mothers. So when we now talk about how when we speak to them, especially the hospitals, because we already or again established that hospitals are overwhelmed, clinicians are overwhelmed, and it's sort of like very incorporating these things to them. Again, the technology that we then use is not, we don't make it overwhelming. So it's something, for instance, if you want to take the mental health screening, you can simply take it on your phone as a mom. You don't necessarily have to be in the hospital sitting with the doctor, and the doctor can get your screening results on their own platform or dashboard as well, right? So I think that generally it will be that, yes, for clinicians, we understand that you're overwhelmed, but it's important that if you're going to deal with the issues of maternal health in Africa, in Nigeria, or we need to look for technology that can make the work easier, and also use it so that we can better support the moms that we offer this care to. And for investors generally, I think that the first speaker also, I loved her session because it literally covered most of the conversations that we are now having, which is that when it comes to healthcare, when it comes to fem tech, when it comes to women's health generally, and health generally, really, it's not fintech. It's not so you'd understand that it's a different ball game entirely, because we are doing so much more than just pitching the product or selling the product to someone and then making money from it immediately. We are building structure. If you're building femtech properly, you're building structures. You're putting structures in place. You're ensuring that all this huge gap that you're trying to close. There's so many things that you have to factor into, and then so generally just looking out for brands or femtechs that are solving real problems and supporting them, but beyond the money. Personally, when we want to look at investors or organizations that support brands, we look at beyond the funds that they give. Do they provide access to market, for instance? Do they provide some level of, education for you? Are they just going to say, okay, take the money and then that's it? Because businesses that want to really grow, they need so much more than the money. They need so much more. They need guidance, they need advisory, they need so many other things that just helps them, to solve the problem or pushes them to solve the problem that they are trying to solve.
Thank you very much. Thank you so much for mentioning that the scope of women's health and building for women's health is it actually covers a lot, and it- for a brand to actually give comprehensive care, then it has to be holistic.
Yes.
Does your brand currently offer mental health services?
Oh, absolutely. On the mobile app, you can actually take mental health screenings. And how we are building is, you can speak to individual providers on the app. However, we have a hospital management platform that allows your provider to also see your mental health screenings. So, and then offer support to you from your home, right? Because we understand that as a new mom, you don't necessarily always want to commute, right? But your provider also, the distance to your provider should not be it should not hinder you from getting support. So for hospitals that then decide to use the Lavender Care hospital management system now, they are able to also support their moms from the comfort of their homes. So you can take a mental health screening from your home, and then your doctor, for instance, or your hospital, because when you're signing up on the app, you need to be asked for your hospital. So it means that we want to again try to bridge this fragmented care issue of care fragmentation, so that we connect you. You can use the Lavender Care app on its own, but beyond that, you can also we also ensure that your provider also has access to your data. So, for instance, you log your symptoms, you take mental health screenings, your doctor has access to all of this. This would help them to, we're not working in isolation. We're working with existing providers because the women have their babies in the hospital, right? So we want to ensure that there's continuity of care even beyond childbirth, and that's what we are solving. So yes, there's a mental health screening that you can take on the app. Then you are then connected to like a therapist or someone who can support you depending on your screening results. Yeah, and then we just support you. And then there's a dedicated care coordinator who follows up on you just to ensure that you get the care that you need and deserve at the time.
Thank you so much. That's actually offering women a very much needed care, especially
Yeah,
for women who have just put to bed. Okay, so
absolutely.
we'll move to Evelyn. What would you say actually needs to change, both in the ecosystem or in founder readiness, when you want to deploy more capital into the African femtech? What needs to change from both the ecosystem and the founders themselves?
So I think like the biggest challenge that we have right now is just that there aren't enough players in the ecosystem. And so for somebody like us, we're looking at it of like we can't do it all, right? And and companies are going to need more capital after us. So if we put capital into a company now, then what? If the big players aren't willing to also take on these companies, then groups like ours, it's kind of like, there's no handoff after we work on helping them grow. So that's the biggest challenge for us right now, is coming up with partnerships with other investors that can come in with us, or that could take over once, because we do very small checks, once the company is bigger than what we can support with. So for me, it's just having more people involved and more people willing to invest in femtech.
Okay, thank you. Thank you very much for. We actually need more investors, more people who are willing and interested in supporting women's health, specifically for Africa. Thank you, Evelyn. Dr. Millicent, I want to ask you something that is very direct. What would it actually take in terms of evidence, design, and trust for you to recommend a femtech solution to your patients?
So I want to answer this question, picking it up from where Evelyn has left, both as somebody who's worked with startups, advised startups, and also used the solutions that startups have built. Yeah. So first, recommendation to patients comes with, has the tool been deployed sustainably? Because I don't want to recommend something that the minute funding ends, it will no longer be accessible and available to the patient. So what does sustainable deployment look like? Then the second thing is, there needs to be checks and balances. Whatever content is inside those solutions, if it's an aggregator platform that there are other healthcare workers on the other side, what are the stages that have been taken to do your due diligence that I'm not meeting healthcare workers, or my patient is not encountering people who misinform or mismanage the actual patients? If it's, for example, algorithm-based or even AI-based solutions that I want to recommend to my patients, has the content been tested and verified within the local protocols and guidelines, as well as within the local regulatory frameworks? So that said, it goes back to the issues of building. Who are we building for? And Anne mentioned very clearly, what problem are we solving? If we get those two things right, we will build relevant solutions in the shortest time possible with the least level of investment. So for my message to the innovators is to remember that it's not about how fancy the app is. It's not about how complex the technology is. It's about how practical it is as incremental value to already existing solutions. It's as simple as automating a form. That is also a femtech solution. So going back to the build is for us to be able to recommend to our patients, for us to be able to build that trust for utilization, it's what is the foundational structure of whatever solution you're bringing to us. On the issue of funding and financing is to understand that generally healthcare systems are underfunded. And Evelyn has asked a very important question. After the investor, the angel investor or the initial investor has given you funds, so what? So from the very beginning, our femtech platform should integrate to already existing practices in the hospitals. Interoperability equals sustainability, because if I'm waking up every day with a government-led HMIS, or I'm waking up every day to certain processes, and you come and build your solution on already existing processes, there's a very high possibility that with or without funding, they will continue to run on existing infrastructure, existing processes, and existing users. So the funding of these solutions and the building goes hand in hand, because the investment effort is almost on a weighing scale. So for me is a message to the founders that small innovation, leverage already existing infrastructure, already existing users. The biggest currency that we have, I think Anne mentioned that data is a big gap. And actually, from a clinician's perspective, anybody who can help me consolidate, clean up, analyze, and give me data for informed decision making, now that's a solution we're going to listen to. So two things is relevant context, even from a data standpoint, that can help us to drive those policy change. Because remember, we are the ones interacting with patients every day. Data that already is available, can we synthesize and make it useful through our femtech tools to help us build business cases for the funding, to build business cases for sustainable deployment within our local setting?
Thank you. Thank you very much for explaining that in depth. I would like to say that most time any tool that is built for women and they cannot bring it to their clinician and the clinician makes sense of what data has been collected, then it may not exactly serve women because the goal is not to build outside the or exclude clinicians from what you are building. The goal is that at the end of the day, it should be useful to both the patients and the clinicians who will eventually help these women. So it's important that we work hand in hand with clinicians. Thank you very much. We'll be moving to the third theme. We'll look at what are the opportunities. What are the opportunities that we can see in Africa as we build or invest in Africa? And I'll go back to Anne again. Um, what would you say has been lost in translation while building for women? That's what would you say you wish women understood, investors understood. The last time we talked about the policymakers, but the investors themselves, what would you say, what would you wish they understood in regards to building for women's health? Whenever you have to pitch to investors, what's the gap that you see between what you are building and what they are asking of you?
I think I sort of like touched on this earlier, and which is the fact that healthcare generally and women's health is a unique sector. It's not fintech. It's not agriculture. It's a unique sector, and it's important that we understand that first. And generally, when I even speak to people or individuals who are also building in this space, what I generally advise is, not everybody is your target investor. Not everybody would understand what you're building or the problem you're solving. So find those that align with, that understand that space and are willing to walk the journey with you, understand it, and really want to solve the problem that you are solving or walk the journey of solving that problem. So I think that generally investors who understand how healthcare works and really want to invest in women will not necessarily, we don't necessarily have to say so much to them. We just need because they understand it, right? And that's where they invest in. So I think for it will be now because we've identified the investors or the investor is, invested in health or women's health generally. They understand the space. They understand what we're building. They understand the shortfalls. They understand the problems. And so it's left for the builders themselves or the founders to now build solutions, like we've said, that truly solve problems and not just fancy mobile applications, right? I think that would be it for me.
Thank you. Thank you. Apps that truly solve problems. That's very important. Uh, and yes, like you said, anybody who sees what you are building would be able to relate with it if they are truly interested. So, Dr. Millicent, if technology could solve one women's health problem in Africa, just one, what would you want it to be and why?
Of course, it's for me to give us quality data for decision making at all levels, first at the patient level, at the hospital levels, and at the policy levels in terms of national investments. Simply because unless we have the right data sets that speak to our local realities, it's very difficult to build an investment case for healthcare, specifically women's health, because it will always be a number, but it will be a number that has no meaning. So today, for me, is all hands on deck towards consolidating and aggregating existing data, continuously generating local data, so that now we can be able to start shifting the narrative and the perspectives around health, specifically women's health, that if you invest in a woman, if you invest in a woman to be healthy, this is what the numbers are telling us: longevity of life and just the overall economic gain, because the women are the backbone of our society.
Thank you very much. That's a major gap that would actually need to be bridged if we want to move forward in women's health. Okay, over to Evelyn. a lot of founders are hesitant and they feel like they may not be able to get funding when they are building for African women. So what would you say to an African founder or a woman who is building who feels like the funding landscape is just not for them? What would you say to them?
So I think that there's like a couple a couple suggestions that I would make. The first is that, I think that one of the things that makes founders very successful are people who have like a really moving story. I mean, I can see in all the comments that are happening right now, like people really resonate with what Anne said. I'm sitting here, I'm 6 months postpartum, and like I'm moved by what she said. Like I'm excited about what she's doing. And so a founder that talks with passion, with yeah, just with confidence is incredibly important in basically getting funders to also believe in you. So, working on your public speaking skills, working on what that story is and why you're doing it, I think is really, really important. And the second piece that I think founders need to focus on is, you know, investors don't want to hear this like super rosy story that like everything is great and there's no problems and you're just going to make a ton of money or make a have a big impact or whatever. We all know what the realities are, and I think that when a founder can come out and say very specifically, these are the challenges, these are the things that I'm trying to mitigate, or how I'm trying to mitigate those challenges, but this is what the reality is, then it gives investors more confidence knowing, okay, she is grounded, she understands what's going on, she knows the risks, and she has her eye on them. So I think those are two things that I always suggest to founders on, how to become marketable for investors.
Thank you very much. I believe the founders in this chat today are listening, and they'll benefit from what you have just shared now. But if what would you say is the one biggest untapped opportunity in African femtech right now? That's it. One
So
white space that you feel has not gotten enough attention as it should have.
So I think that with everything that's going on with AI, it is just super, super exciting right now, specifically for the femtech space, because I think you had said earlier, like when these people bring tools to clinicians, and with AI, it's gonna swap that. Clinicians can come out and say, "Hey, I have this problem. How can I fix it?" And especially, women who have these kind of like micro problems, with AI we can make these very specific solutions. And so I think that, like, we're a couple things, we're going to see a change in the type of founders that are out there now. It's not in femtech, it's not just going to be people with software development backgrounds, it's going to be clinicians, and and other type of medical workers that are trying to solve their own problems. And the other thing that I think is exciting that we're going to see is more like of these kind of like very nuanced, very specific solutions. So instead of, and I think that those are going to end up being very successful in the medical field, because so much of the medical field is specific. And so if you can figure out how to solve a very specific problem, and then again with like interoperability and all of that, you can really have a really great business without trying to go out and solve every problem anymore. You can just solve one specific one and be really successful at that.
Thank you very much. Thank you for highlighting that. So I believe those who are looking to start up or build something in the femtech space, they can actually look closely into what you have just added. Thank you very much. Like I mentioned earlier, you can drop your questions in the chat, and would ask our panelists your questions at the end of this session. Okay, I think we'll have our final words in just very few seconds or minutes. What's the one thing that you want the participants of this session to go home with? What's the one final thing that you say to them? We'll start with Anne again.
Okay, I think that generally, first of all, I'll be biased because I'm building it in maternal health. So Africa is on its Nigeria specifically is on its way to become, the third most populous nation in the world. And what that means for us is that when we are building, who is going to grow this population if not women? Right? So if we don't build for women, if we don't solve for women, then it means that there will be a problem. It means that this vision of being one of the largest, have one of the countries with the biggest population or one largest population, either as a nation or as a continent, will be impossible because women then begin to fear, okay, I don't have the support, okay, this will be impacted. Women leave their jobs, just to care for their families, which is not a problem. But if we had care provided for them, they can continue to be superstars. They can continue to, contribute meaningfully to the economy. They can continue to do great things without necessarily having to box themselves just to be one person. I think women can do so many things if they are rightly supported. And I think that would be the final words for me, really. Women need to be supported because we bring so much to the society as a whole. Thank you.
All right, thank you very much. Dr. Millicent, you can go next. What's your final thoughts for the participants of this session?
So thank you so much. Just to say that femtech is the future, but we need to build simple, sustainable solutions to solve the problems to the greatest point of impact for our society.
Thank you. Thank you very much. Femtech is the future. Okay, Evelyn, we'll have your final words now. So thank you.
Just to kind of leverage off both of Anne and Dr. Millicent have both said, the other thing to highlight is women have money, and women are the ones that are making decisions about their family's healthcare. And so for the investors in the room, femtech is not a risky investment. Femtech is here. It's going to be successful. It is going to take a couple years for some of these investments to really start paying out. But once they do, they are going to get you your money back, and they are going to be solid investments. So I say, jump in.
All right. Thank you very much. Thank you. I've been seeing the questions in the comment sessions and we'll get to that. Okay. Please keep dropping your questions. I'll just move over to the second brand spotlight. And that will be a toolkit that I've built for femtech founders, those who are building for women. And it's called the Femtech Red Flag Readiness Checklist. So we'll drop the link to that in the comment section. It's for builders who are building for women and want to follow up if what they are doing is actually going to be relevant for women. So it's a free assessment tool that helps you check whether your product has the clinical infrastructure to actually detect when something is going wrong for the women using it. So there's a tendency that we build tools that women use, and then by the time they put in their details, it's unable to pick that there are red flags and then also tell them what to do next. So women keep logging in data that is dangerous, that can have negative impact on their health. But these apps, these tools, they are unable to pick up the signs. So using this free toolkit helps you assess really if what you have built can pick up the signs for these women who are using your app. Because a lot of times when founders are building, they rarely stop to ask, does my product know what danger looks like? Can it detect a concerning pattern? Does it know what to do when a woman's data is telling a serious story? So these are things that founders should actually pause and ask when they are building a tool. So we have 7 critical areas that the toolkit covers, and it's free. So I would really encourage our founders here and those interested to, you can just use the toolkit, you answer some questions, and you get insights on your response and how ready your app is for women. And for those who have already launched, is it doing the right thing? Is there something you need to do differently? It doesn't just stop at you doing the assessment. It gives your result and interprets that result and gives you next step to take. Okay, thank you. I do hope that we'll make use of that tool. Now we'll be going to our question and answer session. There has been a lot of questions in the comment section. So I'll start with this. This is from, okay, it says In Search of Wisdom, that's the account name, and it's directed to Anne. Anne mentioned that Nigeria is not among the top 5 countries that has opened up to lavender care. What reasons has she discovered? It's worrisome, actually. Okay, so Anne, what would you say are the reasons Nigeria has not opened up to your app or your tool, lavender care?
Oh, okay. Actually, not lavender care. I stated that before lavender care, I still currently run the organization called Postpartum Support Foundation. And so I was just saying that for Postpartum Support Foundation, the audience that, resonated with the content, with everything we're putting out, were not necessarily Nigerians. This was in 2018, right? So, but Nigerians are getting to, become familiar with maternal mental health and mental health issues. So it wasn't lavender care, but it was Postpartum Support Foundation, actually. If you're speaking, I can't hear you. Is it just me? Can you hear me?
Okay, sorry.
Yes, can hear you now.
This question is also it's also to Anne from Dr. Angelica. She says, does lavender care work with PHCs, that's primary health cares, and general hospitals across Nigeria, or do they only work with private hospitals in Lagos? Okay, was I heard?
Okay, yes, I heard you. I was muted. Can you hear me now?
Yes, we can.
Okay, so yes, lavender care works with PHCs and general hospitals. Of course, you know that we were in conversation with Lagos State government actually some months ago. But obviously, we are not just building for Lagos State, we're building for everyone. But I mean, we'd have to start from somewhere. So yes, we absolutely work with everyone. One of the things we do that, the general hospitals open their doors to us is education. So basically, during the antenatal classes, we go and basically educate not just the women, but the providers themselves about certain things that they need to do. So we then do capacity building workshops, just to support these providers to be able to then support the mothers in their care. So yes, we work with everyone.
All right, thank you very much. Okay, this question is from Shamsia Aliyu. She said, I'm a women's health physiotherapist who provides solutions that help solve women's pelvic and obstetric health problems. Her questions are, many women in Africa, especially Nigeria, still lack access to antenatal, postpartum, and pelvic health physiotherapy care. What strategies do investors believe can help scale this type of service sustainability across low resource settings? So I believe her question is directed to Evelyn, our investor here. I'll take the question again. Many women in Africa, especially Nigeria, still lack access to antenatal, postpartum, and pelvic health physiotherapy care. What strategies do investors believe can help scale this type of service sustainably across low resource settings?
I mean, that's a good question, and I don't know if that's a question that investors generally answer. That's a question that founders have to answer. I mean, just in general, when we talk about like what I think, is something that could work, right? I mean, what we've talked about in the past is like, investors are looking at companies that have something already working in the community, right? And that are based in the community. And I think there's an aspect that's really important around trust to make a successful company. So, for the companies that are working in that space, I think those are the things that we would look for in order to invest is locally made solutions that have trust within the communities.
Okay, thank you very much. Our follow-up question to that is, what key indicators make investors confident that a women's health startup in Africa is ready for investment?
I wish I could answer that because it's so frustrating that every like VC or investing firms or private equity, I mean, they're all different, right? About like what their criteria is. And a lot of people are not clear on, on what that criteria is. Some investors look at annual revenue, some investors look at growth potential, some investors look at just like, number of users. So it's really hard to say. It depends on the type of money that you're going after and the type of investor that you're talking to. Yeah, sorry, I'm not more helpful on that.
Right, thank you very much. I think there are also a lot more questions, but we'll have to quickly take the third brand spotlight for today. And we have Kautar from LOK Natal Care for the third brand spotlight for today. So you can go ahead, please.
Hi everyone. Good evening. Can you hear me? Hi.
Yes, we can hear you. Good evening.
Hi. Yeah, good evening. So thank you so much for having me this evening. And let's say, based on existing protocol, I see innovators, I see women that are interested in women's health, and I'm elated about this conference because it's not every day we see women come together to talk about issues that affect us, talk about the problem that affect us. Yes, someone was saying, I think Evelyn, I kept listening while I was backstage. Evelyn was saying she doesn't resonate with when a man is talking about a woman's problem. She doesn't resonate with it because a man cannot completely, picture whatever it is a woman is going through. So how can a man give a solution to a problem? So it's not every day we see women come together to talk about issues that affect us, especially on policy, on financing, on founding an organization and the rest of it. So thank you so much for hosting this conference. My name is Kausar Okpemilawol. I'm a public health advocate, a maternal and reproductive childhood advocate, and I'm the executive director of Lock Natal Care. So Lock Natal Care is, please kindly confirm you can hear me. Hi, Media, are you there? Can you hear me? Okay, thank you. Thank you so much.
Yes, we can hear you.
Okay, thank you. So Lock Natal Care is a community-driven intervention, that is focused on reducing the inequality gap with maternal health, right? Especially during childbirth, after childbirth, and even more. In fact, when a lot of people were speaking, when Anne was speaking, when Dr. Dr. Miss Millicent, yes, when she was speaking, I was just trying to resonate with each and every one of them because one of the key things we are doing at Lock Natal Care is our deep community intervention, and we are doing that through advocacy, research, and to ensure that we get accurate data because a lot of people have been talking about social media, a lot of people have been talking about femtech and the rest of it. Yes, we are also doing something related, but most of our work at Lock Natal Care is deeply rooted and deeply committed to community intervention projects because for us at Lock Natal Care, that's where the maternal mortality is high more. So for us to get accurate data, for us to make informed decisions, for us to ensure we capture every woman to solve these problems, we go directly to the root cause and we go near these women. because when you see anybody, let's say the World Health Organization or anybody quoting maternal mortality statistics in Nigeria, trust me, by the time they say 71 women out of 100,000 live births, trust me, when we look deeply, we would have ×5 of that statistics, because data is a huge gap and data is a huge problem when it comes to maternal health and maternal mortality. So that is where we come in. We are using our community intervention project to assess each root cause in each community and see how we can leverage, we can reduce inequality gap, reduce maternal death gaps, and also get adequate data for our work. So that's it basically.
Thank you so much, Kauta. Thank you. Thank you for enlightening us on what you do at Lock Natal Care. And you can drop your social media handles so that we can follow and see what you do for women who want to participate. Thank you very much. Okay, we have exhausted our stipulated time for this event. So I'm sorry we may not be able to take the other questions, but I really appreciate everyone who has participated. Thank you so much. Thank you to our audience, the women and men actually who joined us and listening in. Thank you so much to our global speaker, Anna Sein. Thank you to our panelists, Dr. Wanjeri, Evelyn, and all those who also joined in and gave brand spotlight. Thank you very much. Thank you so much. And the last thing I would like to say is I run a weekly newsletter for clinicians, investors, and mostly for women who are building the founders. So I share weekly insights on credibility and how to build products that can withstand regulatory scrutiny. So you can please check out the website is www.betterwomanhealth.com. The link will also be shared in the comment section. You can check it out. Thank you, everybody. I do believe that this is the beginning of the Better Woman Health Conference. We'll be back. And the conversations will go even deeper. Thank you, everyone. The recording of today's session will be shared to all registered participants, so you can look forward to that. And you can please share with anyone who should have been in this room today. Thank you so much. Thank you to everyone. And I hope to see you in the next conference. Goodbye. Thank you.
Fast. Conditions that once took years to diagnose are now being identified in months. Women are walking into doctor's appointments better informed and seeing real changes in their health. Digital tools are making care more personal and more accessible, and it's only getting started. But Africa's voice in this global conversation is still too quiet. That is about to change. On March 11, 2026, the first ever Better Woman Health Conference is bringing together the women driving this shift and the builders, founders, and operators shaping what comes next. The theme is Breaking Barriers, Women, Health, Africa. So whether you are a woman who wants to understand what's being built for your body and your health, or you are in the room building it, this is your event. It's a 90-minute virtual conversation where you'll hear directly from clinicians, founders and innovators building the future of women's health across Africa. And you get to understand what it means for you personally. So register and